you have to have a relationship with your doctor. You have to trust them. So it's like finding a really good friend or finding a good church, but you have to feel comfortable. So um, for each individual person, that may be different. I did read a narrative written by a patient who was looking for and advising other patients, actually looking for physicians who she thought would treat her equitably. And one of the things that she advised was in the research, looking to see whether this person did their training in an area that was diverse, or whether their practice or where their clinical practices are in areas that are considered diverse and multinational, because that may give you some insight into the clientele that they have and the type of diversities of the patients that they treat.
I'll also add to that when you do find a doctor, the personality of the person and how it impacts the interaction is important. I think there are times when, at least I've heard from patients that they've encountered doctors who cut them off, interrupt them, don't listen to them, don't allow them to fully express themselves. And I think in those situations, it obviously is a significant disadvantage to patients. And so I encourage patients to find doctors that can connect to them, that allow them to leave the encounter feeling a sense of respect and a sense of a two-way communication stream. I think the nature of medicine, the way it's practiced, sometimes requires doctors to see as many patients as they can, as quickly as they can, and move fast. But it doesn't excuse the need for a one-on-one humane interaction between the doctor and the patient. So I think if patients find themselves in systems or with providers who do not have that touch, that personal touch, then it's probably a recipe for dissatisfaction in the long term.